Hello, everyone. My name is Shania Epps, and I will be talking about hip dysplasia in canines. So, first, we're going to talk about what is it. So, hip dysplasia, often referred to as development of dysplasia of the hip, involves the improper formation of the socket of the hip bone or the femoral head, which is the ball of the hip joint. This can lead to instability, which means the joint may dislocate or be prone to dislocation, especially during certain activities that involve flexion or extension. The joint may not fit properly, causing abnormal loading during ambulation, which can result to atrophy, which is the muscle wasting of the surrounding hip due to disuse. The diaphysis, which is the shaft, and the epiphysis, which is the end of the femur, could be affected, particularly in pediatric cases where development is still ongoing. So, atomically, mya, which refers to the muscle, and hypertrophy, which is increased muscle size, may occur in compensatory muscles due to poorly functioning hip joints. Conversely, atrophy may occur in muscles that are not utilized due to pain or instability. Hip dysplasia can lead to joint issues, including osteoarthritis, as the joint surface experience abdominal wear. It could also cause some inflammation that may develop in response to joint malignant. Osteo, which refers to bone, conditions can arise if the blood supply is compromised due to instability. So now we're going to talk about where is the organs of interest located within the body, and also where are they in relation to other commonly known anatomy. So you got the proximal femur, where the hip joint is located at the proximal, which is the upper end of the femur. Then you got the pelvis, which is a part of the pelvic bone, which is composed of three fused bones. The joint is situated within the pelvic region, providing stability and supporting the hind limbs. Then you got it where it's medially, which the hip joint is medial to the greater, a bony prominence of the femur that serves as a attachment point of muscles. Then laterally, the hip is lateral to the midline of the body, allowing for proper leg movement and function. Then you got anteriorly, the anterior to the isthmus, which forms to the lower portion of the pelvis, and posterior to the abdominal cavity. Then you have the quadriceps muscle, which is anterior to the hip joint. And then you also have hamstrings, which is located posteriorly. The hamstring muscles cross the hip joint and are responsible for flexing the knee and extending the hip. So in canines, is this condition acute or chronic? And how would we know? So in canines, hip dysplasia is primarily considered a chronic condition. Genetic predisposition, canine hip dysplasia often has a genetic component, meaning that it can develop slowly over time as the dog matures. It is most commonly diagnosed in young middle-aged dogs, but underlying abnormal development begins early in life. This chronic condition could also have progressive symptoms. So some symptoms may include difficulty in movement, limping, of course, reluctant to jump, typically develop gradually as the dog ages. These symptoms may start mild and then they could also worsen over time, especially if the condition is not managed. While dogs with hip dysplasia may experience acute symptoms, for example, following a sudden increase in activity or injury, these episodes are usually manifestations of the underlying chronic condition rather than a new diagnosis. So acute flare-ups might occur but do not define the overall nature of hip dysplasia. Now, why is this important to discuss? Okay. So hip dysplasia is a prevalent condition in certain dog breeds, particularly in larger dog breeds such as German Shepherds, Golden Retrievers, Labrador Retrievers, and Rottweilers. Understanding its prevalence can lead to better awareness and monitoring among pet owners and veterinarians. The condition is chronic and can lead to progressive pain, discomfort, eventual loss of mobility because it develops over time. Early detection and intervention are crucial in managing the condition effectively. And then also it can have an impact on quality of life. Dogs with this chronic condition may experience chronic pain, have difficulty with everyday activities such as walking, running, or climbing stairs. This affects the overall quality of life and can lead to behavioral changes due to pain or frustration. Now, challenging to treat, while there are various treatment options available, including physical therapy, medication, surgical interventions, treatment could be complex and may not always result in complete resolution of the symptoms. Proper management requires a dedicated and sometimes long approach. Now, as far as in the cost of the treatment, managing hip dysplasia can be financially burdensome sometimes due to the cost associated with veterinary consultations, diagnostic like x-rays, medications, and potential surgeries. Awareness can lead to better preparedness regarding financial implications. How was this noticed? What are the clinical signs and symptoms? So, some dogs may limp. Inconsistent or persistent limping, particularly in the hind legs, is a common sign that may indicate pain or instability in the hip joint. Reduced activity level. Dogs with hip dysplasia may exhibit a reduced enthusiasm for activities they once enjoyed, such as playing, running, or jumping. They may also avoid stairs or jumping onto furniture. Also, difficulty in movement. Difficulty getting up from lying or a sitting position. Stiffness after rest can indicate hip joint discomfort. This stiffness is often more noticeable after a prolonged inactivity. Are there any signs of inflammation associated with the condition? How would we recognize this? What organ or anatomy is inflamed? What is it called? So, some things you will see is swelling. There may be observable swelling around the hip joint. The swelling can be due to synovitis, which is inflammation of the synovial membrane, or increased fluid in the joint. Effusion resulting from inflammatory processes. Heat. The affected area may feel warmer to touch compared to other parts of the body, as inflammation typically increases blood flow to the area. Pain response. Signs of pain where the hip joint is palpated or manipulated, such as yelping, flinching, or withdrawing, could indicate inflammation to the hip area. Some dogs have stiffness with the inflammation in the hip joint, which may exhibit the stiffness, especially after resting, or difficulty moving the joint through its full range of motion. So then you have the hip joint. The primary site of inflammation is the hip joint, specifically the synovial membrane surrounding the joint, leading to synovitis. Now, the surrounding structures, which is inflammation, may also affect the surrounding muscles, ligaments, tendons, which can become irritated or inflamed due to compensation mechanisms during the movement or in response to joint instability. So, what diagnostic tests can be done to utilize to confirm the presence of this condition? So, I put two here, and there are also many others as well. But first thing first, is going to be that physical examination with that veterinarian. So, the veterinarian will conduct a thorough physical examination to assess for clinical signs of hip dysplasia, such as limping, as we discussed, reduced range of motion, and pain response when palpating the hip area. Gait analysis. They will observe the dog's gait, such as any awkward movement patterns or signs of discomfort during the activity. Helps in initial assessment. And then secondly, I put which was most important in my opinion is those standard x-rays. Radiographs are the most common and effective diagnostic tool for confirming hip dysplasia. X-rays can reveal abnormal positioning of the femoral head, changes in bone structure, and also joint space irregularities. This here are my references. I really hope you enjoyed my presentation. I hope you guys have a nice day.